Good afternoon, Chamber members. For those of you that I have not met yet, my name is Marissa Shera, and I'm the President and CEO of the Greater Fairbanks Chamber of Commerce. The Fairbanks Chamber is taking steps that align with advice being given by professionals to protect our community from the spread of infection by bringing you today's program from the Carlson Center to you at home or in your office. I'd like to take a moment to thank our executive partners. Without them, we would not be as strong and as loud and as supportive of our Fairbanks community as we are. So thank you so much to all of our businesses that are executive partners. You'll find those logos on the banners behind me and also on our website. I'd also like to give a special thanks to First National Bank Alaska. They are today's luncheon sponsor or presentation sponsor. We're grateful for the community or continued support from members like them that make these presentations possible. Thank you again to First National Bank Alaska, and we look forward to hearing more from them in our program later. Next, I'd like to invite Brenna Shockey from the Fairbanks Chamber up to recognize our new and renewing members.
Thank you, Marissa. We'd like to thank the following renewing executive partners: Interior Gas Utility and Jeans Chrysler. We'd also like to thank the following renewing members, PDC Engineers, Alaska Housing Finance Corporation, Kathy Mayo and Associates, and Alcan Builders. Thank you for renewing your membership, and we look forward to seeing you soon.
Thank you, Brenna. The Fairbanks Chamber continues to closely monitor the rapidly evolving issues and recommendations related to coronavirus. And we continue to keep those affected by this pandemic situation in our thoughts. This includes those that operate retail, service, and hospitality-based businesses, and all of those whose jobs and businesses have been affected in a myriad of ways. Our focus is, as always, on advocacy and support of our business and economy. Many of you have seen a letter from the Interior Alaska doctors to the governor that was published in the News Miner on March 23rd. Those 50 doctors that signed on to this letter all agreed on two things. Alaska needs a travel ban and a shelter-in-place order immediately. While our governor and Department of Health and Social Services have encouraged Alaskans to stay home and released a steady stream of health mandates that are chipping away at what Alaskans need to do in order to minimize these effects, it's clear that our community's current behaviors are not adequate to flatten the curve and ensure adequate health care resources will be available when those in our community become ill. We urge the business community, acknowledging the risks to our livelihood, to take action sooner rather than later to minimize the risks to life. The sooner we enact our own shelter-in-place measures, the greater the impact that will have on the security of our most vulnerable residents and our healthcare system. The sooner we act in our own best interest, the more we can shrink the negative impacts to our businesses. We can, and we have to, do this together. The Fairbanks Chamber is joining the ranks of other businesses to get our employees working from home effective immediately. We stand by our healthcare providers. We stand by our businesses. We stand by our community as we all dig deep and support one another as we get through this time. The Fairbanks Chamber's Board of Directors met yesterday and heard updates related to the University of Alaska on debt servicing. We heard an update on how the legislature plans on progressing through the remainder of this session and in the weeks to come. And we also heard an update from the U.S. Chamber on proposals being considered by Congress to relieve businesses and employees in this crisis. From here on out, for the foreseeable future, at least through the month of April, we do plan on continuing to bring you these weekly luncheons via live stream here from the Carlson Center. You'll be able to find a link to these luncheons in our twice weekly email called The Scoop that goes out to all of our subscribers, and you can also find that on our website. I'd like to give a special thanks to GCI, who has agreed to provide the internet connection that we need to produce and stream a high-quality production such as this. We thank them for their continued support of the Fairbanks Chamber. Our government relations met this morning, and they heard from the Small Business Administration about their disaster relief loans available to small businesses and to nonprofits. We heard that while Alaska became eligible over the weekend, the system is being inundated with requests, which is leading to frustration from businesses trying to apply for SBA assistance. The SBA is working on securing additional resources to deal with this added capacity of a nationwide declaration. I do want to let you know that everyone at the Chamber is working hard to keep us all informed on fast-moving issues that affect us all. We're in the process of standing up a portion of our website dedicated specifically to information relevant to businesses in our response and reaction to COVID-19. This includes information from federal, state, and local resources. Our staff is now all going to be working from home and will remain committed to the mission of the Fairbanks Chamber, to our members, and to our community as we all work through this challenging time together. You can find more about everything the Chamber is doing at fairbankschamber.org. And now we'll head into our main presentation. The Fairbanks Chamber does prioritize and encourage the health of business community as a whole. From financial to physical well-being, we are remaining calm and communicating the most up-to-date information that we have to help guide our member businesses through these difficult times. With that in mind, we're pleased to have Liz Woodyard, registered nurse and also Chief of Clinical Services for Fairbanks Memorial Hospital and Denali Center, Dr. Michelle Nace of Foundation Health Partners, here to communicate the latest updates and let our local businesses know what they should do in this present time. First, I'd like to ask Liz Woodyard up to the podium. Thank you.
Good afternoon, and thank you for the opportunity to present to all the Chamber members update about COVID-19. We've been working very hard at the hospital, and we'd like to give you an update of what we've been doing. For the agenda today, we're going to talk a little bit about the timeline, how many cases we have in Alaska, the importance of social distancing, what businesses can do, the economic impact, and what's next. So we'll start with the timeline. It's been a fast-moving pandemic so far. If you think back to November 17th, it's not that long ago, we have the first case in Wuhan. We moved quickly to China notifies the World Health Organization of a cluster of 41 cases. Moving on to January, we identified the new illness as a new coronavirus. We have our first fatality in China, and then it quickly spreads to Thailand. And in January 23rd, we have our first case in Washington State. January 30th, WHO declares a global public health emergency. February 2nd, we have our first fatality outside of China, which is in the Philippines, and the outbreak begins in Iran. February 21st, the outbreak begins in Italy. And then we have our first fatality in the United States. On March 8th, Italy places 60 million residents in lockdown. And this is really important to think about. 2 weeks from when it first began an outbreak in Italy to March 8th, Italy did not suggest staying at home, social distancing, and in 2 weeks we had such a rapid spread. We now are having a pandemic, and on March 13th, President Trump declares a national emergency. March 12th, we have our first positive case in Alaska. Of course, we know that was in Anchorage with the international cargo flight pilot. March 16th, first 2 positive cases in Fairbanks. March 17th, Italy reports 19 deaths in 1 day. And we have fatalities of over 10,000. On March 22nd, we have 7 confirmed cases in Fairbanks for a total of 22 cases. But we know 2 days later, we have 36 cases in the state of Alaska. So it is quickly spreading. Our Alaska case count, it's a little bit hard to tell there, but these numbers really are changing day to day. And so the numbers that we reported on March 22nd no longer apply today. Next, I'm going to talk about the importance of social distancing and sheltering in place.
Hi, I'm Dr. Angelique Ramirez. I am the Quality Medical Director for Foundation Health Partners, and I have a presentation that I'm going to share with you today. It's about connecting the dots. There's been a lot of information out in the media, and a lot of people have a lot of questions, and they don't understand why this outbreak is different than anything we've experienced before. And it is complicated, but I have a few slides that will help make it simple so that you can understand why we're giving you the advice that we are giving you and why it is so important to comply with it and how it will make a difference for our community and keep us safe. So first off, this is a very different disease. One critical point is that it is a new disease. We have no experience with it previously. We are constantly learning. We are constantly getting information from China, from Seattle, from Italy, and we're incorporating it into how we are preparing and how we are planning to deliver care here. But it does mean we are constantly having to learn and change everything we do as more information comes to light. Another critical thing about why this outbreak is different is that this disease is very contagious. It spreads very easily. For every one person who is infected, 2.5 people on average will get the infection. It is spread by droplets. So droplets are the specimens that come out of your mouth, like when you're coughing or sneezing, but they also come out of your mouth even in normal speech. So that's why we're asking everybody to stay 6 feet away, because sometimes those droplets can come out 3 feet away, 4 feet away, 5 feet away, and you don't even realize it's happening, and that can create infection in other people. The other reason that this is different, it's very important to understand that based on studies coming out of China, 80% of those who have the infection have a very mild illness. Sometimes they don't even realize that they are ill. It's a low-grade temperature, it's a little bit of a cough, and so usually we go about our normal day-to-day business with those type of symptoms. However, you're infecting other people. The other critical point here is that 14% of people will require hospitalization and 5% will require ICU care. That is care that we are very able to deliver here in Fairbanks. It's not so easy to deliver though if everybody requires it at the same time. So what else is different? So a lot of people have asked, so is this kind of like the flu? Is it a little bit worse than the flu? Well, the flu, here's a graph that explains the fatality rate for the flu. It's the black bar on the left, 0.1%. With COVID-19, it's about 12 to 20% higher for the fatality rate. And as you can see, the distribution is much higher for the older adult. This is a little bit of a complicated chart, but I thought it was really important for people to see this to help understand. This comes out of Wuhan, China. At the time, so I'm going to use a term called lockdown. So it's an unfamiliar term, but we use it as physicians to describe the point where the city was quote-unquote locked down, where they implemented social distancing and asked everybody to stay home. At that particular point in time, the yellow bar represents the number of patients at that time who had a positive test for COVID-19. It was only 400 people. The blue bar, based off of research that was done later, represents the actual number of people in the city at that time who had the infection. At that time, it was 2,500 people who had it, even though they only had 400 cases. That's why they locked down the city at 400 patients. So this is a chart describing the symptoms. The most common symptoms are fever and dry cough. Flattening the curve. This is a chart that's out in the social media lately. So this is a description of how an epidemic occurs, a new outbreak. The red part of the graph describes what happens in the natural course of a new disease. You have a high peak and then it slows down. The problem with that, if we allow that to happen, is that everybody gets sick at the same time and it can overwhelm our healthcare system. If we can slow down people getting infected and getting ill, we can take care of everybody the way we always do without any problems. So here's an example of 2 cities back at the time of the Spanish flu epidemic, and one city followed the rules with a lockdown and another city chose not to. Philadelphia did not follow the lockdown advice, and they went ahead and had a parade and large gatherings and overwhelmed their healthcare system and had a much higher fatality rate. St. Louis at the time of one case, they immediately locked down their city. Everybody complied with it, even though there was pushback, and they had a much, much lower fatality rate. So here's the graphs. At the time of the Philadelphia lockdown, Spanish flu in 1918, only 40 people were infected, but it was already too late. And you see the high peak for the fatality rate. And fatality is a fancy word for death rate. The dotted line is St. Louis, and you can see how the death rate in St. Louis was flattened out and spread out over much time and far, far lower. So this is why we're asking everybody to practice social distancing. Something totally new. We've never done it before. But here's a pictorial graph of what that means. Again, same facts as I shared earlier, that for every one person, we'll infect 2.5 people, but that multiplies. It becomes exponential. So at the end of 30 days, you have 400 people infected. But the bottom part of that graph, if everybody stays home, if everybody practices social distancing, you only have less than one person infected for every person. And guess what? In 30 days, we only have a few people infected from that, and we can take care and provide excellent health care. The experience in Seattle, where they did not know this information at that time, we are fortunate to be able to learn from their experience. They are suffering from high inpatient capacity. Their healthcare system is overloaded. We do not want that to happen here in Fairbanks. The community is beginning to finally realize the seriousness of this situation with school closures and cancellations of large gatherings. We hope that this more aggressive response helps blunt the spread locally, but our concern is that enough patients have been recently infected that when they decompensate in a few days to weeks, our capacity will be overwhelmed. This is information that has been shared with us by an emergency room physician at the end of last week, with a message to help us understand how we can protect our community and not allow it to happen here. So what can we do? We can decrease the rate of spread. That's why we're asking for people to stay home and to practice social distancing. We can also protect our health system capacity. We are working together diligently as a medical community together to make sure that we have enough space, supplies, and staff to do the best job that we can. The main message here, though, we are asking everybody, we do not want our healthcare system overwhelmed. We want our community safe. We want our loved ones cared for. Please stay home if you have traveled out of state. Please stay home if you're sick, even if you have mild symptoms, a low-grade temperature, a little bit of a cough. Please stay home. And if you are needed for essential work, we thank you. Our healthcare workers, our first responders, our utility workers, we need you to help keep our community safe. But while you're working, please practice social distancing, keeping a minimum of 6 feet apart from other people. I want to thank you for this time, and we want your help. If we all work together, we can keep our community safe. Thank you.
We will continue with our slides. As you can see from the video by Dr. Ramirez, she had many, many good points to reiterate to our community. This slide is similar to ones that Dr. Ramirez had in her presentation. It really speaks to flattening the curve. The red bar shows if we don't do social distancing, keep 6 feet away, stay at home, how rapidly the cases can spread. The green line shows if we can flatten the curve, which is what everybody's been talking about by doing our social distancing. And the blue line is what happens if we kind of social distance for a while, flatten the curve, and then we can have a reoccurrence if people just kind of start acting as normal and the epidemic is not over. So next we'll talk about what businesses can do and what you can do. So the number one thing is to have your employees work from home if it's possible. And I know it's not always possible. But if they do report to work, if they have any fever or any respiratory symptoms, send them home. And that would be a cough, fever. Some of the other symptoms are fatigue. There's other symptoms, but fever, cough, fatigue, those are the main ones. And we're saying that if you have a temperature over 100, you should probably go home and monitor yourself. You should try to keep 6 feet of separation from each other at work. You may have to redesign your workflow. And everybody is doing virtual telehealth meetings, telehealth with the physicians, Zoom meetings, just what we're doing here today. And increase the frequency of cleaning at your work site, especially your door handles, handrails, elevator buttons, and anywhere else that you frequently touch. We all know this is having an economic impact on people in Fairbanks and the small businesses, and it is significant, and we do want to talk about it today. Many businesses have already been significantly impacted. Cost of mitigation, just using PPE, extra cleaning, you're having loss of revenue, restaurants, bars, entertainment, and tourism. We know it's really affecting everyone. Also, it is at the hospital. We are not having elective cases. We're not having people come in for routine screenings if it can wait. We're doing diagnostic testing, but we're not having anything that can be postponed. We're not having people come in for appointments anymore. And so we are also being hit hard with decreased revenues. What we have put into place is how to do business differently. And so we have the hotline, which people can call in if they have any questions about their symptoms, if they have any general questions, if they can get a referral from a physician by the phone to get tested. Our infection prevention consultants have been out working with other partners in the community, especially our assisted living partners, any other community partners that have communal living. And then, of course, we set up our drive-through testing, which has been very popular, and it's going very, very well. So people that do have symptoms can get tested, but they don't have to come into a building. And we do have many extra expenses in setting up additional safety measures, so we are feeling the impact just as much as you are. The impacts are likely to deepen. We know that many employees may not be able to report to work due to illness. We're having the same issue at the hospital. We also are aware that in some sectors, layoffs will occur. And the uncertainty as to when the contagion will be contained or a vaccination is developed creates really a lot of uncertainty for us at the hospital and for you and your business. What's next? The best case scenario is that the government leaders, business leaders, all of us as leaders come together and act quickly in this current but diminishing window of time to curtail the spread of infection in Fairbanks. And that's kind of going back to that slide and flattening the curve. There's still a spike in cases from those who unknowingly had contact with initial positive patients that have not been identified. We have many cases right now. People have had testing, but we don't have all the results in. So that's why we're really encouraging people, if you have symptoms, to stay home. With shelter in place, the spread of the virus is limited to those already been having contracted the virus but haven't yet developed symptoms. We need to continue to practice good health habits as a community, and we need to encourage very limited travel outside of the community because we want to risk the new infection rate. And we hope that we have a vaccination in the very near future. I'd like to introduce Dr. Michelle Nace. She's one of our wonderful pediatricians at Foundation Health Partners, and she has a few words she'd like to share with you, and then we'll open it up to questions. Thank you.
Hi, I'm Michelle Nace. I'm a pediatrician at where are we from? From Foundation Health Partners at Tanana Valley Clinic. And I'd like to read you a few words to help kind of better explain our point of view as a medical community. In communicating the plea for shelter in place, I'm echoing words shared by Dr. Landon, a physician in the lower 48 experiencing the crisis just a few days ahead of us. This is the voice of your Fairbanks medical community. This virus spreads before you even know it. You might think it's just a cough or a cold. It might not feel more than just the flu. The real problem with this, it's not the 80% of us who are going to get over it in just a week or two. It's the 20%. The older, the vulnerable, the immune compromised, or those with other medical problems that are going to need more support. They're going to need hospitalization, oxygen, and life support. We can't take care of everyone at once. We don't have the medical providers, we don't have the supplies, we don't have more nurses waiting in the wings. There's no vaccine or curative message. There's only one way that we can help this problem. There is no way to make this go away fast. All we have to minimize spread of this virus is physical distance, keeping people apart. If we let every person infect the 2 or 3 people, and they then infect 2 or 3 more people in our community, there might not be a bed, a doctor, or a ventilator when you or your family needs it. The number of positive tests we have today, that's the number of people who got sick a week or 2 ago. This vastly underestimates the amount of disease in our community. Those who feel healthy right now, or maybe have mild symptoms, might not even realize they're contagious. It might take another week for them to feel symptomatic, but they likely have the virus and could be spreading in our community without even knowing. As these new patients fill our hospital beds, this leaves next week's patients with limited options. Without taking strong, decisive, and deliberate steps right now, we worry this will overwhelm our community and increase the loss of life. Sheltering in place is having a clear message that people need to stay home. This is the best tool our community has to limit spread. If successful, shelter in place might feel like it was all for nothing. And that's our hope, that nothing happens to you or your family or your friends. With a real commitment to shelter in place, we can make a difference. By decreasing spread, this allows your medical team to have the time it needs to care for the patients in front of us, to prepare for future patients, and to keep you safe. We need your support. We have been working hard to combat this virus, and now we need you to help as well. Please stay home and shelter in place. Thank you.
Thank you, Dr. Nace. We'll open up for questions if you have any.
There is one question is about how many ventilators do we have here in our community, and are there enough for the potential number of patients that may need them?
All right, Dr. Nace.
Give me the question.
How many ventilators are there in our community, and will it meet the potential demand?
The question is, how many ventilators do we have in our community, and will it meet the demand? The answer is, there's not enough ventilators if we don't take steps now.
Are there tests to find out if one has already had COVID-19?
So the question is there a test that tells you if you've already had COVID-19? And to my knowledge, that is not one that we're testing for.
There's demand or a desire for more information about the testing, the drive-up testing facilities, like where they are, and maybe repeat the referral information.
Do you want me to go ahead? Okay. So all of the things that I say are going to be prefaced by, at this time, what we know now is, because it's changing continually. So I can give you a process and tell you about the testing center, as the question was asking about the testing centers, but know that it could change tomorrow or at 4 o'clock. But here's as I understand it. Right now, the testing centers that we have, there's one at Chief Andrew Isaac, there's one at the hospital emergency room, and there's one outside of Tanana Valley Clinic adjacent to it. The process, as I understand today, is all of them require a referral from a doctor and an order in order to be tested. You cannot drive up and say, I'd like to be tested. You need to have evaluation. So I can't speak to the exact way in which Chief Andrew is doing it, but I can talk to how we're doing it within Foundation Health Partners organization. The first step, if you are interested, is to need to be able to decide, are you symptomatic? And the concern is, and we can help you make that decision. There's a hotline that has been established that you can call and talk about your symptoms, and they can help decide what your best next step is. So currently, we have a collection of doctors who are on a phone to help be able to make those decisions. So when you first are screened, you'll be screened by a nurse, clinical staff, to kind of help direct you where you should go next. If you were to come in and walk into or have an appointment with your provider at Tanana Valley Clinic, that decision can help be made right there. But we are encouraging you to also use a phone as opposed to come in person. The setup that we have today could be different than what we have tomorrow, but that's the first step.
Thank you. Do you have enough tests for those who need to be tested, and when will there be a faster test response?
Do you want me? Okay. Sure. So the question was, do we have enough tests? So currently we're following the state and CDC guidelines about who we're testing. So we aren't testing everyone. If you are at home and you have symptoms, we are not saying come in so we can test you. We are testing it to reserve it for and help those who are more vulnerable, those who are in higher risk population, not just to see if you have the test or not. So we're kind of doing it on a stratified for multiple reasons. One, if you're sick, we don't want you to come in unless we decide medically you need the attention and the care. So initially, what we're deciding is, do you fit into that category? And if you're in that category of high risk, we might say, we need you to come in and be tested. So we go through a scenario, if you will, of a patient. If I am concerned about my symptoms and feel that that testing might be indicated, I can call and get initially screened. Once I'm screened, and by screening I mean they're going to ask you questions about your history, who you are, what your exposure additionally. If there are questions, then your number will be taken and said you will be called back by a provider. That's going to go into a queue that multiple providers will then call you back and go over in depth and decide, yes, this is what we want you to do and you should be tested. That information would be forwarded to the testing center, and you would be instructed to go there. You go to the testing center. You're not going to have to get out of your car. You have your ID to prove who you are, and we have the order that was given by the physician. You can be tested right from your car, and then you are going to be given the instructions when you leave, the same as if you're a positive or negative. You need to go home and stay home and remain home until the duration of your symptoms are done, and then 72 more hours. On the side, in terms of the emergency room, if you walk into the emergency room, immediately you are going to be asked questions as well to decide which direction you should go. And they're going to point you. If they want and think that the screening says you should be tested, they're going to divert you in one direction. And then through another screening process and evaluation by a doctor at that time will decide should you be tested, and it can be performed there as well.
There's just like 3 more questions.
Okay.
New York notwithstanding, how does the increase of cases in Fairbanks compare to other cities around the country?
Go ahead. You might as well just stay there.
Can you ask me the question one more time?
New York notwithstanding, how do the cases in Fairbanks align with what we're seeing in the rest of the country?
Okay, so the question is, how does what we're seeing in Fairbanks align with the rest of the country? And I'm going to put the rest of the world. we're not different. We are at the same place, and we have the ability right now to make it different. So when you look at how our curve is, how their curve is, if we don't take action now, our curve has the potential to look just like Italy's.
All right. Lots of questions in the same vein on this one, so I'll just I'll pick this one. What else can we do to persuade the governor to mandate a shelter in place? And then the stem-off question of that also is, what can community members do to assist healthcare workers, hospitals, and clinics?
So that's a long question. Okay.
We can take the first one first.
Okay.
What else can we do to persuade the governor to mandate a shelter in place?
The question was, what else can we do to mandate the governor put a shelter in place? I think what we can do right now is we can adopt the steps of it. That, to me, would be our plea from the medical community. From the government standpoint and what they recommend, we respect that. We're asking for more. We're asking to have our community to take the steps just like it was a shelter in place.
And final question, what can community members do to assist healthcare workers, hospitals, and clinics?
So the question is, what can, as community members, you do to help us as medical providers, or the whole district? The first thing that I would ask is that taking a look at the business that you have. Are you taking all the steps to keep the employees you have, the community you serve, safe? Are you doing all you can to follow those guidelines? If you're unsure what exactly those are, you can go to the CDC website, and it has a specific thing to recommendations for what business owners can do, and it lists it all out there. So that can be one source. So by setting the example, you are speaking a huge amount for those around you. These are hard things to accept. These are not something that we asked for and said, hey, this looks like a great idea. It's not that we think that these are fun things to do or easy things to do, but they are necessary things to do if you want to protect our community the way I think we all want to.
Thank you so much.
Yes.
Thank you.
Thank you so much to Liz and Michelle. I'm going to follow suit here. I'm going to hand sanitize. We definitely appreciate that you both took time out of your day to come and help us spread this information, this very important, critical information to our community and to our business leaders as well. Next, I'd like to invite Jen Imus up here to the podium from First National Bank Alaska. Again, as a reminder, First National Bank Alaska is a sponsor of today's presentation, and we genuinely appreciate the support so that we can continue to provide valuable information to the business community while we're taking a slightly different approach in the way that we deliver it. Jen?
Thank you, Marissa, and thanks to the Chamber and the Chamber staff for taking time to put this forum together. Thank you to our partners at Foundation Health Partners for making yourself available to spread this important information. Bankers are also on the front lines. We are essential service, so along with healthcare providers and others, we are working to do our part. So as we continue to navigate the presence of COVID-19 in our community, our first thought is for the safety and well-being of individuals and the businesses that are impacted. The people of Fairbanks are very good at coming together to support each other. And at FNBA, we're committed to providing you the financial access, guidance, and support you need so you can focus on your well-being and your loved ones. To accomplish this, we're reminding our community members of all the different channels that you have to access our services. We're doing this because we've made one significant change to our lobby access, and I'm sure it's one you can appreciate. We're limiting access to make sure we're practicing social distancing to preserve the health of our employees and you as our customers. It's a big change. So here's what hasn't changed. Pretty much everything else. We have all of our other channels that we hope that you've learned to enjoy. So you can bank online anytime and deposit checks by just snapping a picture on your phone. You can send and receive money through Zelle with our mobile app. You can call our branches to get answers to your questions and to schedule appointments for more complex transactions. We're in there, we're just not inviting everybody in with us as we have in the past. You can get service through our branch drive-thrus and ATMs. So this is our pledge to you. We will be there. So what we ask of you in return, please be on the lookout for suspicious email and text messages that may try to convince you to share sensitive information, such as username and password, or ones that may impersonate a company, a charity, or a government agency. As if you receive a suspicious email or text, please don't respond, click on any links, do not open the attachments, verify the authenticity of any website before making a purchase or donation, and never provide personal information over the phone, email, or text message. First National and other banks will never reach out to your customers via phone, email, or text to ask for personal information. If you have questions or concerns, please reach out to your banker. I hope this sounds like a fair trade. So in closing, I'd like to acknowledge that this situation is fluid, but we will do our very best to continue to protect our employees and be available to you. So thank you.
Thank you so much, Jen. I also wanted to take this opportunity to just point out that while there are a few of us that have gathered here in order to bring this production to our members, we are also practicing what I'm now calling physical distancing behind the cameras. We're all spread out and making sure that we're providing that 6 foot of separation. We have our hand sanitizer. And so these are practices that if you do have to be in a space with other people, those are things that you can do in order to protect yourself, as I know that everyone has heard many times. Thank you again to Jen and First National Bank Alaska. Thank you to GCI. Thank you to Foundation Health Partners. Oh, I'm getting a side stage question. Hold one moment. Absolutely. Dr. Nace would like to come up and make a couple of more comments, and we have plenty of time, so come on up.
Oh, now I got to do this again. So there was a question earlier that I could address in a little bit better way, and I wanted to, because I think it's one that you all have, and is how can we as a community help our healthcare providers and staff and other essential people out there in the community who are working their tails off to make this better. And so one of the things that we have a email that you can send to, and I wanted to share that so that if you have an idea or you want to do something, here's at least a place you can say, how can I help? Or I have this, and I'm going to give you that email, and I think we'll probably have some way in which to communicate it to you as well. But it's FHP Community Feedback at foundationhealth.org. So that's one avenue. And I want to talk about some other personal things that you can do. Because the virus and we're having the social distancing, it's hard to reach out like how we might normally do. So some of the things that you can do is think about those healthcare providers who are putting in those hours at the hospital, taking care of patients, putting in infrastructure. The thing that they're neglecting the most is their families and their home. And they're doing that because that's what's asked of them. So what I would urge you to do is to reach out to those people who are putting in those extra hours, who aren't able to be at home and do their regular tasks, and say, what can I do to help? That could be shoveling their driveway. That could be cleaning off their stairs. That could be, I need to drop off food to my mom who's 65 years old and I can't and don't want her out of the house. It's things like that that you can do that don't go against social distancing, but still provide a community. And I can tell you that last night when I got home at 10 p.m. and I couldn't get up my driveway, the first thing that came, well, after the tears of, oh my gosh, was a phone call. And my friend and her daughter came over and we shoveled from 10:30 to 11. So I could get up because I was still on call in case I needed to come back. And that to me, at the end of that time period, it wasn't tears, it was laughter.
if you missed it. For those of you that normally would have purchased a ticket for today's program, or when you were here, if you would have purchased a 50-50 ticket or set of tickets, I would love to suggest that you take the money that you would have spent today and donate it to a local nonprofit that's providing critical services. I have heard a couple of times over the last few days that the hospital, I believe through the foundation, is accepting donations as our community has many needs at this time. Or spend that money with a local business. Get dinner or lunch ordered for yourself or your office, for your family. Use it in a retail way. Support these businesses that are having to shutter in order for our community to appropriately respond to this pandemic situation. We are working on a presentation next week. Jim Jagger with the Port of Alaska is going to come and talk, and we've already let him know that there are questions about supply chain and wanting to assure people in our community that there is no need to stock up in large quantities of toilet paper or other supplies, as they've got that supply chain working very well like it always has been. And also talking about projects that affect the Port of Alaska. So we're looking forward to hearing from him next week. We do have a couple of issues we need to figure out before we can fully guarantee that that's happening, but that's what we're working on next week. As always, you can find a link for the presentations that we're offering. Each week we'll post that on our website and also in the Scoop, which is sent out twice weekly. If you don't receive that newsletter, please go to our website and get signed up. It's very easy. You just type your email address in the box and hit submit. With that, we are adjourned for the day. Thank you so much, everyone that has tuned in, and thank you again to Foundation Health Partners, GCI, and First National Bank Alaska. Have a great week.